Okay, so good afternoon. So for today, I will be discussing the healthcare epidemiology as one of the topics for microbiology and parasitology. So our outline will be divided into the following: the healthcare associated infections, infection control, and of course the concluding part of the lecture. Okay, so it's very important to take note that to define the term healthcare epidemiology. So it is the study of the occurrence, determinants, and distribution of health and disease within the healthcare setting. This one is very timely, especially now that we are in pandemic. So in the hospital, there are many people responsible for this one. Like say, for example, we have the infectious disease specialist, or we even have an infectious nurse specialist. Because the primary focus of this healthcare epidemiology is on infection control. So when you say infection control, you do not want to spread the infection anymore. Okay? And most importantly, prevention is much better than cure, as the old adage say. So that's the reason why prevention of the healthcare associated infections would also be an utmost priority. Healthcare epidemiology includes any activities designed to study and improve patient care outcomes. So here, we divide healthcare associated infections, okay, into the following, no? Infectious diseases can be divided into two categories. But before we discuss these particular two categories, let us be clear, what do we mean by an infectious disease? So an infectious diseases are actually caused by microorganisms as the etiologic agent. Okay? If the etiologic agent or the causative agent is a microorganism, then that is characterized as an infectious disease. Now, we can categorize them into two. So, number one is those acquired within healthcare facilities. Okay? So, we call it the healthcare associated infections or the HAIs. So, usually, this one, a related term to this one is the nosocomial infections. So when you say nosocomial infections, they call it hospital acquired. But this one is too specific because not all healthcare facilities are hospitals. So that's the reason why a more general term to describe this one would be the HAIs or the healthcare associated infection. Now, number two is those acquired outside the healthcare facilities. So, in other words, these are community acquired. So, outside any healthcare facilities. So, this one is known as the community acquired infection. Okay, so of approximately 40 million hospitalization per year in the United States, okay, an estimated 2 million patients are considered as the HAIs. Okay? So out of 40 million hospitalization, so 2 million daw, okay, at the during the publication of this book sometime in 2015, 2 million of which are considered to be as health healthcare associated infections. Okay, so the question is, what is the most common bacterial causes of HAIs in the United States? Well, the answer is Staphylococcus aureus. Okay, so Staphylococcus aureus, if you remember, these are gram-positive cocci in cluster. So Staphylococcus aureus is the most common. And Staphylococcus aureus happens to be coagulase positive. But aside from being a coagulase positive Staphylococcus aureus, there are even species of Staphylococcus that are coagulase negative. So collectively, we call them as the cons, the coagulase negative staphylococci. And a good example of this one would be Staphylococcus epidermidis. And the other one is Staphylococcus saprophyticus. Okay, so these are examples. These are examples of cons, coagulase negative staphylococci. And then, of course, the Enterococcus. So Enterococcus actually grows in the colon, which means that they are found in feces. And if you are not observing proper hand washing, so there's a big chance that you will also be able to spread Enterococcus. So gram-negative bacilli include Escherichia coli. Escherichia coli is a coliform which is also commonly found in feces. So that's the reason why, proper hand washing is very important to help spread HAIs. So aside from that, we do also have Pseudomonas aeruginosa, Enterobacter, and Klebsiella. Now, the sources of these pathogens are healthcare professionals. So we, as healthcare professionals, are potential sources of these pathogens. Imagine, if you are a nurse, okay, you had this direct contact with one patient, and then you'll be going to another patient. So there's a big chance that you would be spreading these particular organisms. Now, approximately 70% of HAIs are actually drug-resistant bacteria. Okay? So, moving on, what are the most common types of HAIs? So, the most common types of HAIs in descending order, okay, number one would be the urinary tract infections. Okay, so when we say urinary tract infections, okay, UTI, you know that females are more at risk, are actually more at risk than males in getting urinary tract infection because of a shorter urethra. And of course, the proximity of the vaginal opening to the anal opening, to the anus. Okay, so fecal debris might actually contaminate the urinary tract, and that's one of the reasons why urinary tract infections are actually more common in females. Okay, but it doesn't necessarily mean that male couldn't acquire this one. Surgical site infections, also referred as the post-surgical wound infection. That's the reason why your role as a nurse is very important after a surgery. Okay, because you'll be the one to educate the patient on proper wound care so that those patients will not be able to get any more the surgical site infections. And then, of course, the lower respiratory tract infections, particularly nowadays because of the preponderance of COVID-19, especially at the height of the pandemic. So aside from getting COVID-19 as pneumonia, some patients would even die from bacterial pneumonia and from other causes of pneumonia. And then the bloodstream infections or sepsis. Okay, so aside from that, we also have gastrointestinal disease caused by Clostridium difficile. So if you remember our discussion from last time, Clostridium difficile is otherwise known as the antibiotic-associated diarrhea. So if you have an overdosage antibiotics, or a big chance that you might actually get the Clostridium difficile infection. Okay, so who are the patients that who would most likely develop HAIs? Well, number one in considerations are elderly patients, probably because of their age, the immune system becomes very weak anymore. Secondly, we also have women in labor or in delivery. So they are also at risk of developing HAIs. Premature infants and newborns because their immune system is not yet that strong. Surgical and burn patients because Of course, they do not have skin, and skin is our primary defense. Now, diabetic, cancer, and transplant patients, what are the common denominators? All of these patients are said to be immunocompromised. Okay? And then patients receiving treatment with steroids, anti-cancer drugs, anti-lymphocyte serum, and radiations, they're also immunocompromised. Immunosuppressed patients, such as patients with HIV, patients who are paralyzed or are undergoing renal dialysis or catheterization. So all of these patients, okay, are actually more most likely to develop HAI, meaning to say they have all the predisposing factors. They all have the predisposing factors in getting HAIs or healthcare associated infections. So the three major factor, okay, that combines to cause HAIs are number one, an ever increasing number of drug resistant pathogens, which we have discussed last time. So an example of this, if you remember, the most common be the MRSA or the methicillin resistant Staphylococcus aureus. Number two would be the fault of healthcare professionals themselves. It is when we fail to follow infection control guidelines. What are the infection control guidelines? Proper wearing of PPEs. Do you know that there's a sequence whenever you'll be wearing them? And of course, an increasing number of immunocompromised patients, especially now during the pandemic. Okay, so if you notice, um, in the sequences of prioritization during COVID-19 vaccination, we prioritize A1. A1 are the healthcare professionals, the frontliners, and then followed by A2. So A2 are the senior citizens because we consider them as immunocompromised already, and A3. A3 are those with pre-existing conditions such as you're diabetic, if you have high blood pressure, if you have cancer, so they are considered as A3. So these are WHO wouldn't be releasing this categorization without basis. Of course, they have the basis, and the primordial basis is actually considering the state of these patients' immune system. Okay, so healthcare associated infections. Yes, this is the one that I've told you a while ago. The first factor is the increasing number of drug resistant pathogens. And then when healthcare professionals fail to follow uh, infection control guidelines, and of course, the increasing number of immunocompromised patients. All of these are the factors, the three major contributing factors for the presence of HAIs. So aside from these three, there are also additional factors that can contribute to the HAIs. Number one of these is overcrowding of hospitals and shortages of healthcare staff. This happened, I think, last year and the year before that, at the height of the pandemic. Imagine, no, you are already at risk of dying from COVID-19, but you cannot be admitted to the hospital. Wow. So that was really a very sad scenario at that time. Number two, the indiscriminate use of antimicrobial agents. Because, again, like what we discussed last time, indiscriminate use of antimicrobial agents can lead to antibiotic resistance. Okay? A false sense of security about antimicrobial agents. We cannot really rely solely on antimicrobial agents. You really have to take care of yourself and observe proper precautions and protocols in getting the infections. Number four is a lengthy and a more complicated types of surgery. Those surgery that are too invasive. Wow. The more that you expose internal organs, then of course, the more likely there would be HAIs or there would be an increased predispositions to HAIs. Increased use of lengthy of less highly trained healthcare workers. Wow, that's also a sad scenario because of the migration of our world-class nurses in other countries. So what was left behind are neophyte nurses who may not necessarily as experienced as those nurses who had already migrated. Wow. So that's the reason why there is a need for us to have a succession planning and training, not only of nurses, but other healthcare workers as well. And then increased use of anti-inflammatory and immunosuppressant agents. Anti-inflammatories such as overdosing yourselves with steroids or immunosuppressant agents are actually being taken for those renal transplant patients because they couldn't find organs that are 100% compatible with them unless they have a twin. So there's a chance that their newly transplanted organ will be rejected by their own immune system. So to avoid doing that, they are drinking immunosuppressant drugs. However, as a compromise, that will make them that will actually debilitate their immune system. Okay, and then the overuse and improper use of indwelling devices. What are indwelling devices? Well, the most common is a catheter. So overuse or improper use would not also be good. It will also increase the chance of this patient to get UTI, for example. So what can we do to reduce the number of HAIs? Number one starts within the healthcare worker. And then, of course, hospitals should have a proper infection control guidelines. We need to be compliant with these infection control guidelines. And as what I've mentioned to you a while ago, the process is not really that complicated. In fact, hand washing is considered to be as the single most important measure to reduce the risk of transmitting pathogens from one patient to another or from one anatomic site to another on the same patient. So what do we mean by the first phrase? The first phrase means if you are a nurse, if you've adjusted, for example, the IV line of the patient. So before you go to another patient, at least do hand washing. Or if you are a patient, and let's say, for example, you have an infected wound, and then when you touch your infected wound, do not scratch your eyes without even washing your hands, because there is a chance that the pathogen in your infection wound can be transferred to your eyes. So by a simple procedure, such as a proper hand washing procedure, you can actually reduce the risk of getting HAIs. So other means of reducing the incidence of HAIs would include disinfection and sterilization techniques, air filtration, the use of ultraviolet lights, isolation of especially infectious patients. So sometimes, for example, in San Lazaro, during the first few days of COVID-19, they have actually placed a COVID-19 patient in a negative air pressure room so that since the pathogen will not spread, okay, from one place to another. And wearing of PPE such as gloves, mask, gowns, and whenever appropriate. So there is actually a proper way of donning when you wear it, and then doffing when you remove it. Okay, so as what I've told you, proper hand washing technique is considered to be as the most important and the most basic technique in preventing and controlling infections and preventing the transmission of pathogens. Okay, so you know, the basic principle of hand washing is scrubbing will mechanically remove pathogens And the use of surfactants such as soap will facilitate mechanical removal. So, what are the steps? It says here, you have to stand back so that you do not touch the sink because the sink could be contaminated. Number two is that you have to turn on the faucet and wet hands under warm running water. Water should not be too hot or too cold, and hands should be wet before applying soap to minimize drying, chopping, and cracking of hands from frequent hand washing. Okay, you have to apply soap and work up. Okay, a good ladder is needed to reach all surfaces. And then you have to scrub all surfaces, including between the fingers and around the knuckles. So scrubbing is necessary to dislodge microorganisms from first surfaces. So this is what I meant when I say mechanical removal, especially between fingers and around the knuckles. This is where the microorganisms would most likely attach. Then you have to rub your hands vigorously because friction helps loosen dead skin, dirt, debris, and microorganisms. So steps 4 to 5 should take 15 seconds, about the time it takes to sing the ABC song or the happy birthday song, whatever song, for as long as it should take around 15 seconds. Okay, and then you have to rinse your hand downward motion from wrist to fingertips. Why is it necessary? Because rinsing with the hands downward allows contaminants to be flushed from the hands and fingers into the sink rather than flowing back up the arm or wrist. So yung iba ganito, that's not nice. Or yung iba pinapahid sa katawan, that's not also a very good practice. So you have to do it that way. You have to drain. Okay? Dry hands with a clean paper towel. So hands must be dried thoroughly and gently to prevent chopping or cracking. Reusable towels can be a source of contamination. So that's not a very good practice, especially if you are in a healthcare facility. You have to use a clean paper towel to turn off the faucet unless it is a foot or motion activated. You do not want your clean hands, okay, to touch the handles, the faucet handles, because you would be contaminating your hands again. So majority of the of the faucet in the hospitals are actually being controlled by foot, by a foot pedal. So rather than being controlled by a hand faucet, no. However, that is not actually very common. Okay. So let's talk about infection control. So when we say infection control, it is the numerous measures taken to prevent infection from occurring within healthcare settings. You know that in the hospital, there is a nurse that is actually considered to be as an expert when it comes to infection controls. So infection control nurse. And if you will be a scrub nurse in OR, so these are the things, one of the things that you would be considering. You have to observe aseptic technique because the prefix "a" means absence of, and sepsis means contamination. So the term asepsis literally means absence of contamination. And if contamination is absent, then we could say with confidence that it is indeed without infection at all. And there are two types of asepsis. The first one is known as the medical asepsis. So medical asepsis is the precautionary measures necessary to prevent direct transfer of pathogens from person to person or by means of indirect transfer of pathogen through air or an instrument, beddings, equipment, and other inanimated objects. These inanimated objects that could serve as means of contaminating and spreading of the infection, we call them fomites. So what are fomites? For example, a doorknob may be considered as fomites. A contaminated bed sheets in the hospital may be considered as fomites. And let's say, for example, you borrowed scissors from the nurse station to cut the micropore. So that particular scissor can be considered as fomites. You cannot just borrow eyeglasses or sunglasses from one person to another. This could be considered as fomites. So remember, guys, any inanimated object that could serve as a vehicle or as a source of contamination, then we call that fomites. Okay? And then another kind of asepsis is called surgical asepsis or sterile technique. It is a practice used to render and keep objects and areas sterile. So surgical instrument should be autoclaved first prior to its usage. Okay? So that is infection control. Now, surgical aseptic techniques are practiced not just in operating rooms, but it is also being practiced in labor and delivery areas and during invasive procedures. What are examples of invasive procedures? For example, during phlebotomy. So we call it, when you collect blood from your patient, you call it phlebotomy. Or injecting medications, urinary and cardiac catheterization, and even lumbar puncture. What is the purpose of lumbar puncture? The purpose of this one is to collect cerebrospinal fluid or CSF from the third and fourth ventricles. So that's called, sometimes it's called lumbar tap. Okay? So that is also an invasive procedure. And since these are invasive procedures, you are expected to observe surgical aseptic techniques. Okay. Now, what's the difference between the medical and surgical asepsis? So take note of the difference that medical asepsis is merely a clean technique that is acceptable, of course. But if we're talking about surgical asepsis, it has to be several notches higher. And that's what you call sterile technique. And when you say sterile technique, it is the complete absence of all microorganisms. Complete absence of all microorganisms, including the bacterial and the spores. Okay, so that is the sterile. So the goal of medical asepsis is to exclude pathogens. Okay, however, the goal of surgical asepsis is to exclude all microbes. Or because we define sterile as the complete absence of all microorganisms, including the bacterial and the spores, which, by the way, is the most difficult to eradicate. So the standard precautions that we need to observe is that are to be applied to the care of all patients in all healthcare settings, regardless of the suspected or confirmed presence of an infectious agent, which means that we consider everyone as potentially infectious. We do not discriminate. We consider everyone as potentially infectious. Actually, that's part of the universal healthcare precautions. Okay, so how do we do this? By providing infection control guidelines regarding how do we have a proper hand washing, how do we wear gloves, masks, eye protection, and gowns, respiratory hygiene, cough etiquette, safe injection practices, lumbar puncture, cleaning of patient care equipment, environmental control, handling of soiled linens. When you say soiled linens, those that have already been used by previous patients, resuscitation devices, patient placement, and disposal of used needles and other sharps. All of these are actually subsumed under the so-called standard precautions. So, if you are an infection control nurse, you have to be familiar with this poster because here it will give guidelines on proper hand hygiene, proper wearing of gloves, proper wearing of gowns, proper wearing of mouth, nose, eye protection, respiratory hygiene, cough etiquette, patient care equipment, instrument devices, care of the environment, and even nitty-gritty details such as textiles and laundry. All of these are being covered under the so-called standard precautions. So, therefore, because of that, there is now a proper way of donning personal protective equipment and even proper procedure for removing gloves. Okay. And then aside from universal precautions, we also have the so-called transmission-based precautions. So transmission-based precautions are actually being used for patients who are known or suspected to be infected or colonized with highly transmissible or epidemiologically important pathogens such as COVID-19, for which additional safety precautions beyond the standard precautions are required to interrupt transmission within the healthcare setting. If if standard precaution is is actually in place, if, for example, you have known that this patient is COVID-19 positive, then you have to do a much higher types of precaution. And this time, it is now called transmission-based precaution. So this one is now very common because of the COVID-19 pandemic. Do you know that last year I was admitted in the hospital? So I was admitted in the hospital, and then during my first day of admission, they didn't know yet. They didn't know yet if I'm infected or not. Because pandemic is present, they already applied to me transmission-based precautions while waiting for the result of my RT-PCR. So they did everything. So every time they enter my room, they need to wear a full PPE in which those are being charged to me. Okay? So after 2 days, I think the RT-PCR result was already released, saying that I am already negative. No, I am really negative with COVID-19. So this time, whenever these nurses entered my room, they're not anymore wearing the full PPE, but they're just wearing the disposable PPE. So from transmission-based precautions, they went down to standard precautions. Okay? So what are the three types of transmission-based precautions? So we have the contact precautions, the droplet precautions, and the airborne precautions. Okay. So contact transmission is divided into two subgroups. Number one is the direct contact, and the other one is the indirect contact. So when we say direct contact, it is the transfer of microorganisms from body surface to body surface. Okay? Shaking of hands is an example of direct contact. Even if you're now just doing fist bump, there is also a direct contact, but not as much when you shake hands. Okay. Indirect contact is through other contaminated intermediate objects. So, that is indirect contact. Okay, so contact precautions. Okay, so in contact precautions, these are the things that we need to consider. Okay, gloves. So before you well, nowadays, visitors are not being allowed inside the hospital. But before the pandemic, you have to report to the nurse before entering the room. Okay? Then you have to don gloves, you have to observe hand hygienes, you have to wear proper gown, and then you have to consider patient transport and patient care equipment. So that is contact precautions. So before the pandemic, this is the example of disease requiring contact precautions. For example, acute viral hemorrhagic conjunctivitis, my sore eyes, acute respiratory infectious disease, even common colds or flu, aseptic meningitis in infants and young children, chickenpox, cutaneous diphtheria, disseminated shingles, extrapulmonary tuberculosis with draining lesions, gastroenteritis in diapered or incontinent persons, impetigo, that's a skin disease, infection or colonization with multi-drug resistant organisms such as MRSA, major draining abscesses or wound infections, monkeypox, which is now starting to become emerging infectious disease if you have heard the news, poliomyelitis, severe mucocutaneous herpes simplex infections, smallpox, which we have already eradicated, staphylococcal scalded skin syndrome, major staphylococcal or streptococcal diseases of skin, wounds, or burns, viral hemorrhagic fever due to Lassa, Ebola, and Marburg, Crimean Congo fever viruses. These are all examples of infectious diseases that would minimally require contact precautions. Okay, droplet precautions. Again, before visitors are being allowed. So, in addition to the standard precautions, you are required to wear a mask because you do not want droplets. Hand hygiene. You have to place patient in a private room. And then patient transport, you have to limit transportation of the patient and then wear a mask. Before the pandemic, it says here, no mask is required for persons transporting patients on droplet precautions. But nowadays, mask is required everywhere. So let me clarify to you, this book was published before the pandemic. Okay. So these are the infectious diseases that would require droplet infections. So adenovirus infection in infants and in young children, adenovirus pneumonia, epiglottitis, meningitis caused by the Haemophilus influenzae type B, major skin, wound, and burn infections due to group A streptococcus, then scarlet fever in infants and in young children, influenza, meningitis or pneumonia, which can be caused by Neisseria meningitis, mumps, Mycoplasma pneumonia, parvovirus B19 skin infection, whooping cough, pharyngeal diphtheria, pneumonic plague, German measles, SARS caused by coronavirus, and then strep throat in infants, young children, rhinovirus infection, viral hemorrhagic fever due to Lassa, Ebola, Marburg, and Crimean Congo fever viruses. But take note, again, it says here, this one is not right anymore. No mask is required for person transporting patients on droplet precaution. This is not anymore updated. Mask should be worn at all times. And then airborne precautions. Okay. For airborne precautions, patients should be placed in AIIR, Airborne Infection Isolation Room. We have to monitor the air pressure and always keep the door closed. For the patient transport, we have to limit the transport and wear surgical masks for the patient. Hand hygiene should be observed. And then healthcare personnel should be wearing the NIOSH approved N95. N95 should be proper fitting of the N95. Okay, N95 mask, not just an ordinary mask. So these are being required in chickenpox, confirmed or suspected pulmonary or laryngeal tuberculosis, extrapulmonary tuberculosis with draining lesions, disseminated shingles in any patients, localized shingles in immunocompromised patients, measles, monkeypox, SARS, smallpox. Take note that some of these diseases would also require droplet precautions or contact precautions. So this is an example of the N95 mask, okay, when airborne precautions are actually indicated. So what does AIIR look like? Okay, so this is how the AIIR looks like. This is the preferred placement for patients who are infected with pathogens that are spread via airborne droplet. When you say airborne droplet, it is something that is microscopic that you cannot see, but it goes out of your mouth whenever you speak or talk. It is something that is microscopic because this droplet is about 5 microns less in diameter, which means that you cannot really see it. Therefore, it is required that patients should be placed in AIIR. And AIIR is under the negative pressure. So when you say negative pressure, it means that the air is evacuated from the AIIR would have to pass through a HEPA filter. HEPA, by the way, is not the hepatitis, no? HEPA is the high efficiency particulate air filter. So, if air from the hallway enters the room, and if the room is under negative pressure, this air would be filtered out by the HEPA filter before it goes back to the corridor, for example. So that's an example of the AIIR. So air wouldn't go out because since negative pressure, it is controlled and it has to pass through the HEPA filter. Okay. So patients who are especially vulnerable to infection are placed in protective environment. Meaning to say, patients with severe burns or leukemia or immunosuppressed patients receiving radiation treatment, leukopenic patients, and premature patients. So instead of placing them in a negative air pressure, so they are being placed in positive pressure. What does it mean? The room is under positive pressure and air entering the room passes through the HEPA filter because these patients are vulnerable or susceptible. So meaning to say, this air would be filtered by HEPA filter. So patient would only be inhaling clean air because he is immunocompromised. And then air from the patient's room will enter the hallway. Okay, so that is, this time naman is a protective environment to protect the patient. Okay. So handling food and eating utensils. Oh, this is the time that, you know what, the reason why COVID-19 would spread easily during a party, during a meeting, whenever there is always a food involved. Because whenever you eat, you always remove your mask, and that makes you vulnerable. Okay? So some of the regulations for safe handling of food and eating utensils include using high quality fresh food, proper refrigeration and storing of food, proper washing, preparing, and cooking of food, proper disposing of uneaten food because you do not want to serve spoiled food, covering of hair, wearing of clean cloths and aprons, thoroughly washing nails before handling foods, keeping all cutting boards and other surfaces scrupulously clean, and washing and cooking eating utensils in a dishwasher with a water temperature of more than 80 centigrade. Okay, so these are the considerations, especially if you are assigned in dietary or in the kitchen area of the hospital. And you do not want fomites. As what I've told you, fomites are any inanimated objects that could be means of transporting infections. So they are non-living, inanimated, other than food that may harbor and transmit microbes. By the way, I forgot to mention food and water are considered to be as vehicle. Okay? Inanimated objects are considered as fomites. So this include the patient's gown, beddings, towels, hospital equipment, telephone, computer keyboard, doorknob, okay, everything that is inanimated but can be a source of contamination. So transmission of pathogens by fomites can be prevented by observing certain rules. Number one, use of disposable equipment and supplies whenever possible. Number two is to disinfect or sterilize equipment soon after you use it. Number three is to use individual equipment for each patient if it's really possible. Number four is to use disposable thermometer or thermometer covers. But nowadays, it is very rare that you're using the traditional thermometer. So we're just using the infrared based thermometer in getting the temperature of the patient because there is no contact with that particular equipment. And for medical waste disposal, we have to follow the occupational safety and health hazard authority. So I think this one is in United States. No, they have this OSHA, occupational safety. Okay, so standard for disposals of medical waste. Uh, Excuse me for a while. I need to charge my device. Uh, so usually in healthcare setting, they have the so-called Infection Control Committee or the ICC, and of course, including in these committees are infection control professionals. So all healthcare facilities should have some type of formal infection control program in place. So the infection control committee is composed of representatives from most of the hospital departments, including the medical and surgical devices, pathology. When you say pathology, this would be the laboratory department, nursing, hospital admin, risk management team, pharmacy, housekeeping, food services, and central supply. So the chairperson of ICC is usually an infection control professional such as an epidemiologist or an infectious disease specialist or an infection control nurse or a microbiologist. And the role of clinical microbiology in hospital epidemiology and infection control. So CML personnel. So most of these are medical technology. So they participate in infection control by monitoring the types and number of pathogens isolated from hospitalized patients. So they have this census. Okay, notifying the appropriate infection control person should an unusual pathogen or unusually high number of isolates of a common pathogen be detected. And then, of course, processing of environmental samples. So sometimes they are sampling air, they are swabbing the doorknob, the floor. They are collecting specimen from the affected ward or a ward where there has been an outbreak. Okay. So in conclusion, always remember that healthcare associated infections can add several weeks to a patient's hospital stay. So instead of them being discharged earlier, It may even lead to serious complications and even death. So this is a serious matter. So economically speaking, insurance companies rarely reimburse healthcare facilities for costs associated with HAIs, meaning to say the burden will be passed on the patients. And HAIs can be avoided through proper education and discipline compliance within infection control practices. So as future nurses, you'll really play a very important role in HAIs. Then all healthcare workers must fully comprehend the problems of HAIs. We must be completely knowledgeable about infection control practices, and we must personally do everything in our power to prevent HAIs from occurring. Because you're the ones who gone to school and studied microbiology. So you'll be the leader, okay, in a specific area that was assigned to you. Okay, so that ends our presentation for this particular session. Thank you very much for listening.